everyone. My name is Krystinne Espinosa, and I will be doing the head, neck, and lymphatic assessment on my patient. So first thing you do is introduce yourself to the patient. Hello, Mr. Smith. I'm Krystinne. I'm going to be doing your assessment today. Then you double check the information for the patient. You check their armband. Is this information correct?
Yes.
Okay, perfect. So I'm going to wash my hands, and I'll be right back. You do hand hygiene, and you come right back. First, we can start with subjective information. We can ask the patient about, for example, can you tell me when the last time was you had a headache? And they can respond with an open-ended answer. Then we start with the objective assessment. First, we're going to start with the skull. We're going to feel the bones. We see that the head is normocephalic. We're going to feel the scalp that is free of lesions or any injuries. We are going to see that the hair is clean and neat. Then we're going to move down to the temporal artery. We're going to palpate here. Make sure the pulse is not a strong bounding pulse. It's within normal limits. Then we're going to feel the parietal bones, the occipital bone behind the head, and the mastoid process. Then we're going to feel the temporal mandibular joint, and we're going to ask the patient to open and close their jaw. Thank you. And the movement is smooth and without pain. There's no tenderness to the palpation of any bones. Then we're going to move to the face. The facial expression is calm and appropriate for the situation, maybe a smile. The facial features are symmetric. We're going to observe the eyebrows are symmetric. The nasolabial fold and the size of the mouth are both symmetric. The skin color is even on the face. We're going to assess the facial hair is clean and neat, well groomed. There is no abnormal movements of the facial muscles noted. Now we're going to move to the neck. We're going to make sure the neck is midline with the head. The accessory muscles are also symmetric. And we're going to ask the patient to move their head from side to side. Good. Now up and down. Perfect. The motion of the head is smooth and controlled, and there's no pain involved. Next, we're going to test cranial nerve number 11 and muscle strength. We're going to ask the patient to shrug their shoulders against resistance. Perfect. Then, will you please turn your face to the side against my hand? Okay, perfect. So there's no tenderness or pain during these movements, strong controlled movement, and there's no swelling noted on palpation of the neck, and no enlargement of salivary glands or parotid glands. Then we're going to observe for the carotid artery pulsations, which is medial to the sternal-mastoid muscle. No pulsations should be noted while the patient is seated. Now we're going to move on to the lymph nodes. So using our finger pads, we're going to use gentle circular motions to palpate the lymph nodes. First, the preauricular is going to be right here. So we're going to palpate there. Then the posterior auricular behind the ear. Then the occipital behind the head. Then the submental is under the chin. Then the submandibular, a little farther back. Then the jugulo-digastric is going to be right here. Then the superficial cervical. Then the deep cervical chain should start around here, and you follow it. Down here will be our posterior cervical, and below that the supraclavicular. So there is no enlargement noted of the lymph nodes, and the nodes feel movable, discrete, soft, and non-tender. Next, we're going to palpate the trachea. We're going to start at the sternal notch, and you should be able to slip the trachea to either side, so we know the trachea is midline. And then the thyroid gland, we're going to ask the patient to sit up straight, bend your head slightly forward and to the right to relax the muscles on the right side. With the left hand, you're going to push the trachea to the right side. And with the right hand, you should be able to feel between the sternal-mastoid and the trachea. You can ask the patient to swallow. And the thyroid tissue should move up with swallowing, and there is no enlargement noted. Perfect. So, Mr. Smith, you're perfectly healthy.
Great.
From the head and neck. Thank you for watching.